Hi, my name is Mona. This is my patient, Bart. We have already completed our visual acuity test. His Snellen chart he read at a 20/20 vision. We could also do a near vision Rosenbaum test, and his near vision is also very good. So I'm going to start with his eye visual examination. I'm going to look at his eyes. They're symmetrical. His brows are a good amount of hair. There are no styes or sores on his eyes. He seems to be looking, his pupils and everything move together. There are no abnormalities that I can see. I'm going to have him to look up and out yes, and then up and in. There you go. And with this eye, I want you to move up and out and up and in. I do not see anything abnormal in his eyes, just a little redness in the whites of his eyes, but he has been outside all day, and so that's probably some allergies. Are you having any trouble with seeing or any soreness or tenderness in your eyes?
No, just tired eyes.
Okay. So now I'm going to look inside his eyes. All right, you worked a minute. There we go. All right, so I'm going to look inside, look straight at the light. All right, and I do not see any corneal abrasions on the outer eye. So on the inner eye, I have a good light reflex. His pupil is round and sharp. And looking at all corners, I don't see any abnormalities. So I'm going to look at this eye. Again, look straight at the light. Again, I don't see any corneal abrasions or any issues there. I have a good red reflex. His pupil is round and the edges are sharp. And I don't see anything abnormal in any of the corners. Now I want you to follow the light with your eyes. Keep your head nice and still and just follow with your eyes. If at any time you see a double vision, please tell me. Any double vision?
No.
All right, and he does accommodate nicely and appropriately. Now I'm going to have you look straight ahead, and I'm going to flash a light in your eye. His pupils respond briskly, and now I'm going to look at his opposite pupil, and it also responds briskly and appropriately. And now we'll look at this eye. His right pupil responds briskly, and then his opposite pupil also responds briskly and evenly. So his vision and eyes, I see no abnormalities. So next we're going to go to his ears. And with his ears, first I want to check his hearing. Are you having any problems with your hearing or your ears in general? No. Any pain anywhere?
No.
All right. First off, I'm going to put this on your head, and I would like you to tell me where you hear. Left ear, right ear, or both?
Center.
Does that mean both ears?
Yes.
Equally? Okay.
Yes.
And now I want you to tell me when you quit hearing this. Do you hear it?
I do hear it. Stop hearing it.
Do you hear it now?
Raise it up. Yes.
Let me know when you stop hearing it.
Stop.
Okay, now we're going to do the other ear. Tell me when you stop hearing it.
Okay. Okay.
All right, and that was just about double on the air as it was on the conduction, which is normal. Let's see here. So next I will inspect the ear.
Take the other thing out.
Can you hear what I'm saying?
Yes.
Can you hear me on this side?
Easily.
All right, so he's hearing very well, and he's been answering appropriately the whole time, so I'm assuming I'm getting from him that he is hearing very well. So I'm going to look at his ears. I'm palpating them, and I don't feel anything abnormal. He doesn't seem tender. He does not have any abnormal growths. I'm going to inspect the inner canal. I see a good amount of cerumen, but not to an occlusive amount. I don't see any abnormal growths. I do see the eardrum is gray and looks like it should. So now I'm going to go to this ear. Again, there is earwax or cerumen. I do see a gray eardrum, and there is a light reflex, and there's no abnormal growths. Alright, so then I'm going to look at his nose, and first I want to palpate his sinuses. Is that sore at all?
No.
What about that?
No.
Any soreness in there anywhere?
No.
Okay. And now I want you to look up. Lay your head back, that is. And I'm going to look into your nostrils. And there is no deviation. There's no... Both nostrils look open and straight. There's no significant amount of drainage in there. Let's see. So the sinuses look good. Now I'm going to look at his mouth. On the outside, nothing looks abnormal. He smiles. He's symmetrical. There's no sores, no dryness, nice and pink. Open your mouth and move your tongue to that direction. Yes. I do not see any sores on his tongue. His dental work looks good. There's no sores. Now move your tongue to the other direction. Again, no sores to his tongue or his cheeks or his gums or his teeth. Everything looks good. Now stick your tongue out. Say ah. His uvula responds symmetrically and in the center. His tonsils are there but not overly big. I'm going to check his gag reflex.
Oh.
It's present. Let's see here. And let me see his palate also looks good, and it's pink, light pink, not red or sore or anything like that. So, are you having any problems with your ears, nose, eyes, or throat?
No.
All right. I think I'm going to give him a thumbs up on this assessment. Thank you.